Dr. Sheila Nazarian is a plastic surgeon in Beverly Hills, California, and a member of the society who also has a Netflix show, Skin Decision, Before and After.
Furthermore, depending on different studies that you look at, 30%, 60%, 85% of these kids have a concurrent mental illness, like depression, like anxiety, or even a mental diagnosis like autism. And instead of treating these kids' mental illnesses and telling them that they're loved and they're perfect just the way they are, instead they are thrown into this mill of gender affirmation, telling them, yes, you're in the wrong body. If you just removed your breasts, all of your problems would go away. If you just have surgery on your genitals, all of your problems will go away. And we all know, looking at history, that the knife is not going to solve mental problems. We did hysterectomies for hysteria. There's lobotomies. There's a vast history of trying to do surgical procedures to alleviate mental illness, and it hasn't worked out so great in the past. And on top of everything else, these are kids. I'm a mom of 3 teenagers right now, and it breaks my heart what's happening. And in the beginning, I used to think, these, my colleagues who are doing these procedures, they're good people, they're just misinformed, or they're good people. I do believe they actually think that they're doing something good for these kids. When the long-term data started coming out, mainly out of Europe, they were completely ignoring it.
So, doctor, what long-term negative effects are these studies showing?
Well, basically, they're showing that there's no long-term benefit. So the things that were being promised to these kids, and mainly to their parents, was that if you don't do these surgeries, your child will commit suicide. I have a parent in my kid's old school that went through this whole thing with her daughter, who believes she's a boy. And they were told that if you don't remove your daughter's breasts, she'll kill herself. And I don't doubt that she was suicidal at the time, whether it's from depression or whatever. I don't doubt that she was suicidal. But to promise these parents that either you can have a transgender child or a dead child is just not, it hasn't been brought out in the data. And so basically these parents were not given true informed consent. The informed consent would have been, we have no data showing that the benefits outweigh the harm of these surgeries. And so let's go in the operating room. Imagine I came to you and I was like, listen, I have this great surgery for your child, and I don't know if it's going to prevent them from killing themselves. In fact, I don't even know if it's going to help them. Sign here, let's go. Right. I mean, you would never sign such a thing, but that's what the informed consent would have said if they were basing it on data.
Okay. I read a story, didn't name this person, parents of a 15-year-old who wanted to transition from girl to boy and had been wearing, it flattens the chest. Binder. Right. So they talked about the difficulty of the chest binder, and it made the mental health of their child even worse. And they went through more counseling and sessions, and then finally decided to do the surgery, and then said by the age of 17, the child was doing great, that the surgery helped bring about the change in everything that was positive for their child. So that's right. The other side.
But how far out did they ask that question?
I guess only a couple of years, yeah.
That's right. That's the key. So when I asked my colleagues here, what about the 12-year data? What about the 14-year data coming out of Europe? They looked to me and they said, what long-term data?
So what would you do as a doctor for someone who's 19, someone who's 20, comes in and says, now, I want to have this surgery?
Right now, actually, in Europe, because they're not doing the studies here, in Europe, they're actually studying 19 to 25 years old to see if the long-term data bears out benefit. And I don't see this any differently than diabetes research, blood pressure research. If the data shows that there's a benefit, great. If the data shows that there is no benefit, stop.
So What about other gender-affirming treatments or therapies? Do you or your society have opinions formally on those or just on the surgery?
I personally believe that looking at the last 100 years of research, gender dysphoria was happening in 3 to 5-year-old boys, mainly. In the last 100 years of gender dysphoria research, okay?
Yeah.
Only in the last 10 to 15 years has it switched to 13 to 15-year-old girls being the majority undergoing gender dysphoria.
Why?
Why?
What has changed?
Social media, social contagion, and social media. That's what's changed. So we don't want to do long-term therapies. And in my opinion, that includes hormone therapy, because preventing a girl from undergoing normal growth can affect their bones. It can affect their IQ. It can affect their mental health. It affects their voice forever. So why are we letting them remove their healthy breasts? Why are we letting them change their genitals? And there's complications from these surgeries. You know, you look at 𝐃𝐨𝐽, and she talks about how she still has wounds that haven't healed years later.
Will they ever heal? I mean, you talk about irreversible. What does, let's say, a double mastectomy for some, what does that do permanently? I mean, if they decide to detransition,
to be able to breastfeed.
That's what I was going to say. You could never get that back, right?
No, it's a mastectomy.
Right.
It's like having breast cancer and getting all of your breast tissue removed. Furthermore, they take the nipple off of the breast tissue and put it on like a skin graft, so it's insensate. So these are irreversible changes. And, you know, I'll tell you something very disturbing. One of the heads of the hospitals doing these surgeries on children, the head of that department said, well, if they change their mind, they can just go get breast implants.
Wow.
Wow.
That is not what some of them certainly want to hear.
Correct.
There was
unempathetic thing to say.
There was recently in New York a malpractice suit that was victorious. Someone who had gone under breast removal who sued. What does that mean? That person won. What does it mean for plastic surgeons and other doctors for the future?
It means that there's a precedent set. And she won due to the informed consent issue. She came out, she's 22 years old now. She said, I was a teenager. I was mentally ill. I was very unwell. And my psychologist and plastic surgeon pushed me towards this, instead of just taking care of my mental illness. But where they win is because they weren't given informed consent. Informed consent, like the beginning of our conversation, would have said, we do not have long-term evidence that these procedures help. Sign here. And I'll tell you, this has become so politically and ideologically driven. Medicine should not be politically or ideologically driven. I'll give you an example. About a year ago, when the first statement came out from the American Society of Plastic Surgeons, me and a colleague of mine put together a literature review of all of the long-term data out of Europe, which led to many of these progressive countries in Europe stopping these procedures or greatly limiting them. I cannot get it published anywhere. No one will publish it here. I had to reach out to HHS to see if they'll publish it, because no one wants to touch it. God forbid a board member of one of these journals gets upset, because it doesn't go along with their politics or what they believe to be true, instead of what the evidence shows to be true.
In this day and age, aren't people afraid of being labeled a hater if they go against?
Oh, absolutely. They're terrified. They're terrified. They're terrified of speaking up. And, when I go on, shows like this, I get tons of emails from the giants of our society, giants of plastic surgery, saying, I totally agree with you. I'm so glad you're speaking up. And I'm like, well, why aren't you speaking up?
What is your message? If you had someone who was a parent and was like, please help me with surgery, my 16-year-old, I'm desperate. We've done everything and nothing is helping their mental health and they really need this to transition, what would you tell them?
I would tell them that this is not going to help and the data doesn't show that it's going to help. And I'm never, as a mother, if your child was my child, I would never do something to them that the evidence shows doesn't help them and can actually harm them. So I know you're in a bad place now. I don't want to put you into a worse place. So let's go back. Let's review what you've tried. A lot of times I get people in my office for issues that they have. Then they said, I've tried everything. And then when we actually go through what they've done, they haven't tried everything. So I would really try to get them real help with things that evidence shows do help, not give them what they want just because they're asking for it or they're waving money in the air, which is unfortunately what my colleagues have fallen victim to.
Dr. Sheila Nazarian, plastic surgeon, member of the American Society of Plastic Surgeons, and her program on Netflix, Skin Decision Before and After. Doctor, thank you so much for being here. We appreciate your time.
Thank you so much for having me.